Welcome back. In this video, we will go over the action, origin, and insertion of some of the head and neck muscles. Starting with the orbicularis oculi muscle, which is this muscle right here that surrounds the eye oculi. The action is it closes the eyes, produces blinking, squinting, and draws the eyebrows inferiorly. The origin of a muscle, it is the immovable attachment, whereas the insertion, it is the movable attachment site of the muscle. So the origin of the orbicularis oculi muscle, it is the frontal bone, the maxillary bone, and the ligaments around the orbit, whereas it is inserted in the tissue of the eyelid. Moving to the zygomaticus minor and major muscles. This right here is the zygomaticus major, and this is the zygomaticus minor. Their action is they raise the lateral corners of the mouth upward. So this is the smiling muscles. The origin is from the zygomatic bone right here. The insertion, they are inserted in the skin and muscles at the corner of the mouth. Moving to the buccinator muscle, which is one of the muscles of mastication, that is the buccinator muscle, whereas this is the orbicularis oris muscle. The action, it draws the corner of the mouth laterally. So it pulls the corner of the mouth laterally, also compresses the cheek as in whistling. It holds the food between the teeth during chewing. The origin, it originates from the molar region of the maxilla and the mandible. So both bones right here, the mandible and the maxilla, the molar region. It is inserted in the orbicularis oris muscle right here. Moving to the fourth muscle, the masseter muscle. The masseter muscle is one of the muscles of mastication. This is the masseter muscle right here. The action, it is the prime mover muscle of jaw closure. It elevates the mandible. So it traps around the angle of the mandible. The origin, it originates from the zygomatic arch and the maxilla bone. It is inserted in the angle and the ramus of the mandible. So that is the origin, and that's the insertion of the masseter muscle. Moving to the muscles of the neck and throat, the platysma. This right here is the platysma. The action, it tenses the muscle of the neck. It depresses the mandible, it pulls the mandible downward. It also pulls the lower lip back and downward. The origin, it originates from the fascia of the chest and the deltoid muscle. It is inserted in the lower margin of the mandible, the skin, and the muscles at the corner of the mouth. So that's where it is inserted. Moving to the sternocleidomastoid muscle, which is this muscle right here. The action, when laying on the back, the sternocleidomastoid muscle, it causes flexion of the neck forward. It also acts independently as it rotates the head toward the shoulder on the opposite side. The origin, it originates from the manubrium of the sternum and the medial portion of the clavicle, which is this bone right here. whereas it is inserted in the mastoid process of the temporal bone and the superior nuchal line of the occipital bone.